An apocalyptic catastrophe is imminent. Leaked Pfizer data and death rates support Deagle's frightening depopulation forecast for 2025, a controversial forecast from Deagle, a global intelligence and consulting firm, recently attracted attention because it predicted significant depopulation by 2025. While it was initially dismissed as a speculative estimate, current events and emerging trends have led many to wonder whether there may be more to Deagle's prediction than meets the eye. Recent reports from the governments of the United States, Canada, Australia, New Zealand, the United Kingdom, and several European countries have revealed disturbing revelations, including confirmation of a staggering number of excess deaths, exceeding 2 since the mass rollout of COVID-19 injections millions. The United States has also recorded a disturbing 120,000 excess deaths among infants, children, and young adults through week 40 of 2022, and across Europe there has been a strange increase. Further government figures confirming that mortality rates are highest among those vaccinated in every single age group per 100,000 people now raise serious questions about the accuracy and possible veracity of Deagle's apocalyptic depopulation predictions. What is Deagle? The Deagle Corporation is a smaller branch of U.S. military intelligence, one of many secret organizations that collect data for high-level decision-making purposes and produce classified briefing documents for agencies such as the National Security Agency, the United Nations, and the World Bank. She is known to have contributed to a Stratfor report on North Korea. With this kind of pedigree, Deagle should be viewed as a legitimate player in the intelligence community, and not just a source of disinformation. This means that its population projections for 2025, as well as its industrial production projections for each individual nation, are not pure fantasy, but are based on strategic assumptions that are shared and well understood by other actors in the intelligence community. What did Deagle predict? Deagle.com's infamous 2025 forecast was removed from the site sometime in 2020. However, thanks to the Wayback Machine/Internet Archive, we can see the original predictions before they were discovered by critical thinkers. Deagle predicted in 2020 that the UK population would decline by 77.1% by 2025. Deagle predicted in 2020 that the population of the United States will decline by 68.5% by 2025. Deagle predicted in 2020 that the population in Germany would decline by 65.1% by 2025. Deagle predicted in 2020 that Australia's population would decline by 34.6% by 2025. A massive decline is also predicted in many other Western countries. A complete list of Deagle's original apocalyptic depopulation predictions can be viewed by anyone via web archiving. Unfortunately, current events suggest that the depopulation figures were not just estimates. Government reports, revealing excess deaths. Official reports from several governments around the world have set alarm bells ringing by documenting an unprecedented number of deaths since the widespread administration of COVID-19 injections. Official figures provided to Euromomo by the UK government and 26 other governments of countries across Europe show that most of the continent suffered 375,253 deaths in 2021 and 404,600 deaths in 2022. This represents 779,853 excess deaths over the 2 years. The figures do not include Ukraine, so it cannot be attributed to the ongoing war. There were 11,068 excess deaths in Australia in 2021 and a shocking 22,730 excess deaths in week 38 of 2022. This is in stark contrast to 2020. When only 1,306 excess deaths were recorded at the height of the COVID pandemic and before COVID injections were rolled out. This means Australia saw a shocking 1,640% increase in excess deaths in just 39 weeks in 2022, compared to 53 weeks in 2020. There were 2,169 excess deaths in New Zealand in 2021 and a shocking 5,286 excess deaths in week 49 of 2022. These are shocking figures for the small island with an estimated population of 5 million people, especially when compared to 2020, which saw no excess deaths and 160 fewer deaths than expected at the height of the COVID pandemic and before the rollout of COVID injections. This means New Zealand saw a shocking 3,404% increase in excess deaths in 49 weeks in 2022, compared to 53 weeks in 2020. The situation in Canada is similarly worrying. The country recorded 35,318 excess deaths in 2021 and 25,333 excess deaths in week 34 of 2022. In comparison, there were 31,042 excess deaths through week 53 in 2020. However, looking at the numbers up to week 34 in 2020 and 2021, it is clear that 2022 was by far the worst year for excess deaths. In week 34 of 2020, Canada had 17,888 excess deaths. In week 34 of 2021, Canada had 18,498 excess deaths. However, in week 34 of 2022, Canada recorded 25,333 excess deaths, a 42% increase over the number of excess deaths in 2020, before the rollout of COVID-19 injections. This dramatic increase in excess deaths raises serious questions about the safety of the COVID-19 vaccines and whether they may have contributed to the increase in excess deaths. There were 674,954 excess deaths in the United States in 2021 and 434,520 excess deaths in the 49th week of 2022. This represents over 1.1 million excess deaths in almost 2 years. The U.S. saw 674,954 excess deaths in 2021, a year in which the country was forced to take multiple shots as part of the mass rollout of COVID-19 vaccines. These figures represent a significant increase in deaths compared to previous years and have raised alarm bells among both the public and health professionals. The situation has not improved in 2022. By week 49, 434,520 excess deaths were recorded, bringing the total number of excess deaths to over 1.1 million in almost 2 years. This staggering figure raises questions about the effectiveness of the vaccine and the government's response to the alleged pandemic. The official narrative from governments and health organizations was that deaths increased in 2020 due to the outbreak of the alleged COVID-19 pandemic, and that the response to it affected millions of people worldwide. However, as the pandemic progressed and a vaccine was developed and distributed, the focus of the narrative shifted to the safety and effectiveness of the COVID-19 injection as a means to curb the spread of the virus and reduce the number of deaths. This narrative was reinforced through various propaganda campaigns, public statements, and official statements, with the message that the vaccine was safe and effective and would be the key to ending the pandemic. However, figures and official reports released by the governments of the US, Canada, Australia, New Zealand, the UK, and most European countries have shown the opposite to be true. With millions of deaths since the mass rollout of COVID-19 injections are recorded. This has led to many questions about the safety of the vaccine, the facts of the official narrative, and the integrity of governments and health authorities around the world. The figures were provided to both the Organization for Economic Cooperation and Development, OECD, and Euromomo by each country's government organizations. Data for the United States was provided by the Centers for Disease Control. Data for the United Kingdom was provided by the Office for National Statistics. And the Australian data was provided by the Australian Bureau of Statistics. So these are not independent estimates. These are official figures authorized by the government. And they show that the Five Eyes countries and 26 other countries across Europe recorded 1.99 million additional deaths by week 34/49 of 2022 following the emergency authorization of COVID-19 injections. These numbers cast a troubling shadow over the narrative of the pandemic and raise concerns about the actual impact of vaccination efforts, especially when you look at mortality rates per 100,000 inhabitants. The mortality rate is lowest among the unvaccinated. Official figures released by the British government suggest that COVID-19 vaccines may have been the biggest contributor to the millions of deaths in the Five Eyes and most of Europe. The figures can be found in a report entitled Deaths by Vaccination Status, England, January 1, 2021 to May 31, 2022, published on the ONS website, can be accessed and downloaded. Table 2 of the report provides the monthly age standardized mortality rates by vaccination status and age group for deaths per 100,000 person years in England up to May 2022. We've taken the figures provided by the ONS for January to May 2022 and created the following charts, which show the dire consequences of the mass COVID-19 vaccination campaign, 18 to 39-year-olds. The chart below shows monthly age standardized mortality rates by vaccination status among 18 to 39-year-olds for non-COVID-19 deaths in England between January and May 2022. The worst month for mortality rates among those partially and twice vaccinated compared to those unvaccinated was February. This month, the risk of death among partially vaccinated 40 to 49-year-olds was 264% higher than among unvaccinated 40 to 49-year-olds. Double vaccinated 40 to 49-year-olds were 61% more likely to die than unvaccinated 40 to 49-year-olds. In May 2022, 5 months after the massive booster campaign, the mortality rate among triple vaccinated 40 to 49-year-olds was 40% higher than among unvaccinated 40 to 49-year-olds, with the mortality rate among the triple vaccinated at 81.8 per 100,000 and among the unvaccinated it was 58.4. It's the same story in every single age group, as you can see from the two charts below. A full breakdown of the numbers by age group can be viewed here. https://exposed-news.com/2022/08/mortality-rates-lowest-among-UNVCNAT. Given these surprising results, transparency and informed decision-making must be the focus. We need open dialogue, honest discussions, and ongoing research to answer the questions raised in this report. Deagle's prediction and current events. The connection between the alarming death rates reported by governments and Deagle's apocalyptic depopulation forecast for 2025 is a topic that requires further investigation. Originally considered speculative, Deagle's prediction gains credibility as real events unfold and reveal a disturbing consistency with the organization's predictions. The dramatic increase in excess deaths, particularly given the projected depopulation scenario, prompts a critical assessment of the validity of the prediction and the underlying factors contributing to these disturbing trends. Government reports from several countries have shown a significant increase in excess deaths, beyond what would be expected under normal circumstances. The number of excess deaths should have fallen after the rollout of COVID-19 injections if we were truly in the midst of a pandemic that is killing hundreds of thousands of people. But these numbers provide concrete evidence to the contrary, and that's not something you can just dismiss. When contrasted with Deagle's forecast, which predicts significant population declines, the overlap raises legitimate questions about the possible accuracy of the forecast and the forces driving these frightening results. The correlation between the government reports and Deagle's apocalyptic depopulation forecasts for 2025 simply cannot be ignored, especially when we look at what has happened in terms of excess child mortality. In the US, a disturbing 120,000 excess deaths among infants, children, and young adults were recorded by week 40 of 2022, and in Europe, a strange increase in excess deaths among children was recorded as soon as the European Medicines Agency, EMA, reported in mid-2021 extended emergency use authorization, EUA, for Pfizer's COVID-19 shot to children. A graphic shows the official CDC figures for all deaths and excess deaths among children and young adults in the United States before the introduction of the COVID-19 vaccine and after the introduction of the COVID-19 vaccine on December 14, 2020. The figures were the Organization for Economic Cooperation and Development, OECD, from the U.S. Centers for Disease Control, CDC. The figures show that there were only 1,352 fewer deaths among those aged 0 to 44 in 2022 through week 40 than in week 51 of 2022, despite 2020 being the supposed peak of the COVID pandemic and also included 11 additional weeks of deaths. But the most worrying figures to emerge from the chart are the total number of deaths and excess deaths among children and young adults since COVID-19 injections were introduced. Almost 500,000 people aged 0 to 44 have sadly died since week 51 of 2020, resulting in a staggering 117,719 additional deaths compared to the 5-year average of 2015 to 2019. Another chart was created based on figures from the OECD database. The figures were provided to the OECD by the U.S. Centers for Disease Control, CDC. It shows excess deaths among children and young adults ages 0 to 44 in the United States by week in 2020 and 2021. Official figures show there was a slight increase in excess deaths among children and young adults when the alleged COVID-19 pandemic broke out in the U.S. in early 2020. However, with the introduction of a COVID-19 injection, one would have expected deaths in this age group to fall significantly in 2021. But the opposite was the case, and the CDC's official numbers unfortunately show that this trend has continued in 2022. The average life expectancy in the United States was 77.28 years in 2020. If we believe the official narrative that COVID-19 is a deadly disease, then perhaps we could agree that 231,987 children and young adults up to the age of 44 will die in 2020, meaning 40,365 additional deaths are an unfortunate consequence of this disease. But if we believe the official narrative that COVID-19 shots are safe and effective, how can we explain the continued rise in deaths among children and young adults in 2021 and 2022? Because we know that millions of Americans have been forced to get the shots, and we know that millions of parents have been forced to force their children to get the same shots, too. The answer lies in the fact that the official narrative is an outright lie. The COVID-19 vaccines are either one nor the other. And this is confirmed by official government data from Europe. Multiple analyses of data from across Europe have unfortunately found a worrying link between the approval of Pfizer's COVID-19 vaccine for children and an increase in child mortality rates. The most recent survey found a 760% increase in deaths. The data was provided to an organization called Euromomo by the relevant official statistical offices of each European country. The data we analyzed covers the period up to week 12 of 2023 and was collected from 27 participating European countries. For comparison, there are 44 countries in Europe, and the latest data does not include deaths in Ukraine. Therefore, the ongoing war cannot be blamed for the results we found. In calendar week 21 of 2021, the European Medicines Agency, EMA, extended the emergency authorization of Pfizer's COVID-19 vaccine to children aged 12 to 15 years, and a few months later it was extended to 5 to 11-year-olds. But in the weeks following approval, a shocking increase in child mortality rates was reported. And the rise in excess deaths has continued since then. Between week 22 of 2021 and week 52 of 2021, there were 754 excess deaths in children ages 0 to 14. In contrast, there were 309 fewer deaths than expected between week 1 and week 21 of 2021. The increase in excess deaths correlates closely with the EMA's approval of Pfizer's COVID-19 vaccine for children aged 12 to 15 years, and by week 12 of 2023, there were 336 excess deaths, bringing the total number of excess deaths in the 95 weeks following the emergency authorization of the COVID-19 vaccine for children by the EMA to 2,448. This is very worrying because in the previous 95 weeks from week 30 of 2019 to week 21 of 2021 there were 371 fewer deaths in children aged 0 to 14 than expected. There were 360 more deaths between weeks 30 and 52 of 2019, minus 422 excess deaths in all of 2020, and then minus 309 excess deaths between week 1 and week 21 of 2021. This means that the number of excess deaths among children aged 0 to 14 years in 27 European countries, including the UK, France, Spain, Italy, and most of Germany, increased by 760% from week 12 of 2023, since the European Medicines Agency expanded the emergency use authorization of Pfizer's COVID-19 vaccine to children aged 12 to 15. A vaccine that was still in the early stages of development. A type of vaccine that has never before been used in humans due to the risk of antibody-dependent enhancement, AD, and vaccine-associated enhanced disease, VAD. And a vaccine that never had to be given to children because they were not at risk of becoming seriously ill from the alleged COVID-19 virus. As shown by the 521 deaths among children aged 0 to 14 across Europe in 2020, recorded from the outbreak of the alleged pandemic to the end of the year. Impact analysis. An analysis of the impact of the government reports and their consistency with Deagle's forecasts provides valuable insights into the potential consequences of these troubling trends. The alarming increase in excess deaths, particularly in the fully vaccinated population, is of great concern and requires a thorough investigation into the underlying factors causing these findings. The fact that a large proportion of the reported excess deaths occurred in the fully vaccinated population raises questions about the effectiveness of the vaccines in providing adequate protection. At least 2 years ago, further research was needed to understand the possible reasons for this unexpected trend. Furthermore, the implications extend beyond the realm of public health. The correspondence between the excess death numbers and Deagle's prediction suggests the potential for a significant demographic shift with far-reaching social, economic, and political consequences. A drastic reduction in population size can impact, among other things, labor markets, social security systems, and geopolitical dynamics. Understanding and preparing for these impacts is important for policymakers, stakeholders, and individuals alike. However, the drastic population decline could benefit the elites with the rapid emergence of artificial intelligence, AI. The impact also raises broader questions about the overall strategy and approach to addressing the global health crisis. If the excess deaths in the vaccinated population continue, as has been the case for at least 2 years now, it is essential to reassess current vaccination strategies, surveillance systems, and public health policies. Lessons must be learned from these real events to inform future decisions and mitigate further potential public health risks. The problem that the common, hard-working man and woman have is that vaccination has never been about health overall. It has always been about creating significant wealth. Furthermore, the consistency between the excess death figures and Deagle's forecast underscores the need for transparency, accountability, and further independent investigations. Thorough research, comprehensive data analysis, and peer-reviewed studies can shed light on the factors driving these troubling trends and help develop evidence-based policies and interventions. Open dialogue and collaboration between scientists, health professionals, and policymakers are essential to ensure the accuracy of information and the effectiveness of public health measures. However, it can no longer be denied that the implications of the various government reports and their consistency with Deagle's forecasts are profound and require thorough investigation. The problem we have is that we cannot rely on those in power to act in our best interests. The importance of transparency and accountability. Given the high number of deaths and the potential realization of Deagle's prediction, transparency and accountability are paramount. Governments, health organizations, and regulators must provide honest and comprehensive data that allows a clear understanding of the circumstances surrounding these tragic events. Full transparency will enable a thorough investigation into the factors contributing to the excess deaths. But that won't happen unless the public sings and dances about it. Conclusion: the emergence of these quietly released government reports confirming that more than 2 million people have died since the mass rollout of COVID-19 injections has cast a dark shadow over the prevailing narrative. These numbers bear a striking resemblance to Deagle's apocalyptic depopulation forecasts for 2025. Of course, an increase in excess deaths alone does not necessarily mean that countries will suffer from depopulation. This also depends on birth rates. But unfortunately, the confidential Pfizer documents that the FDA tried to keep under wraps for 75 years until a federal judge denied it the right to do so confirm that the mRNA COVID-19 vaccine has a significant impact on infertility and stillbirths and even birth defects. You can read all about it here. https://expose-news.com/2023/03/08/confidential-pfizer-documents-reveal-covid-19-to-depopulation. Independent investigations and a commitment to accountability will help solve this crime against humanity. But we cannot rely on our current leaders to change the course of our future. We must face these challenges ourselves and recognize that there are billions of us, and literally only a handful of them. They only have power because we have been conditioned to give it to them. But with the advent of artificial intelligence, the confirmation of millions of excess deaths closely linked to the COVID-19 vaccination and the significant impact on fertility confirmed by the formerly confidential Pfizer documents, it is now time to act, or Deagle's apocalyptic depopulation prediction will become reality sooner than you think. Source: https://expose-news.com/2023/09/17/leak-pfizer-data-death-rates-2025-predictions/question-UTM_source=pocket_saves